Hey there, folks. Big waves from Medi Cal made easy. I'm Steven Gaitan, your trusty navigator on this journey through California's wallet-friendly health insurance wonderland. As a public health student at the University of California, Irvine, my mission is to make health coverage as accessible as a friendly neighbor smile. My motto, your health, your horizon. Today, I'll unravel the mysteries of Medi Cal, what it is, who gets to join the party, how to sign up, and why it's a game changer. Whether you're helping a loved one, newly eligible, or flying solo without insurance, this guide's got your back. Let's dive in. Here's a table of contents so you are aware of what we will be discussing today. So, what is Medi Cal? California's version of the federal Medicaid program is called Medi Cal. It offers qualified low-income people and families free or inexpensive health insurance. The California Department of Healthcare Services, or DHCS, oversees the program, which is jointly funded by the federal and state governments. Preventive care, such as immunizations and checkups, treatment for long-term illnesses like diabetes and asthma, emergency services, hospital stays, maternity and newborn care, mental health services, substance abuse treatment, prescription drug treatment, dental and vision care, and more are all covered by Medi Cal. Medi Cal's focus on full scope care with low or no out-of-pocket expenses sets it apart from other private insurance plans. Medi Cal is the sole source of health coverage for many Californians. More than 1 in 3 Californians, or more than 15 million people, are enrolled as of 2024. And do remember that it is financed by the federal and state government. Who is qualified for Medi Cal then? The income-based pathway is the most popular. A single adult earning $20,783 or less annually in 2024, this being 138% of the federal poverty level, would mark you at the eligibility income point. The income criteria for families rise as more people live in the home. Other eligible pathways exist as well. Young adults and children up to age 26, those who are pregnant, seniors 65 and older, individuals with disabilities, foster children and adolescents up to age 26, people who receive public assistance programs such as Supplemental Security Income, which is SSI. Additionally, California now provides full scope Medi-Cal to all income eligible residents, regardless of immigration status as of January 1st, 2024, as a result of recent policy changes. California is the first state to take this historic action. In addition, you must be a California resident and present certain basic documents such as evidence of address, income, and identity, examples of identity being your photo ID, passport, or birth certificate. This chart represents the program eligibility by federal poverty level for 2025. As you can see, for a single-size household, in order to qualify for Medi Cal, you must not exceed the threshold of $21,597. However, this threshold changes based on the household size. So, for example, a household size of 2 people will have a threshold of $29,187, and a size of 3 will be $36,777. Of course, if you exceed these thresholds, the application for Medi Cal will immediately send your information to refer you to Covered California, where you can receive other health insurance plans like Silver 94, Silver 87, and Silver 73 based on different yearly income and household sizes as well. So how do you apply? Medi Cal applications are now simpler than ever. There are 3 primary methods to apply. You can visit www.coveredca.com to apply or learn more. This is the official marketplace for health insurance in California. The system will automatically identify whether you are eligible for Medi Cal or a Covered California plan with financial assistance after you begin the application. You can apply in person at the Social Services or Human Resources office in your county, or you can apply with a qualified enrollment counselor that can guide you through the entire process and offer free assistance. What are you going to need though? A picture ID, such as a state ID, driver's license, or school ID. You need evidence of income, such as recent pay stubs, tax records, or letters from employers. You'll need evidence of address, such as a lease or a utility bill. You'll need immigration paperwork if necessary, but keep in mind that recent California regulations still allow undocumented people to receive full scope Medi-Cal. The application is available in several languages and enrollment is open all year round. Here's a quick preview of what the website will look like when you go to apply. You might be wondering, when can I apply? One of Medi-Cal's best features is that unlike covered California, there is no set open enrollment period. You can apply at any time of the year. For example, you might be eligible right away if you just lost your job, had a kid, moved, or turned 26. The first day of the month following your approval of your application is usually when coverage begins. Open enrollment for applicants to covered California will begin on November 1st, 2025 and end on January 31st, 2026. You are eligible to apply for a special enrollment period if you go through a qualified life event. However, Medi-Cal eliminates the necessity for waiting. Allow me to introduce you to Jose, a California resident who is 23 years old and undocumented. He didn't think he would ever be able to afford health insurance and works part-time. Jose avoided going to the doctor for years, even when he was seriously ill, since he was afraid of the expenses and wasn't sure if he would be eligible. He then learned about California's Medi-Cal expansion for residents without documentation in 2024. He applied online with the assistance of a promotora, which is a community health worker, and he was enrolled in full scope Medi-Cal in a matter of weeks. He now has free access to pharmaceutical drugs, mental health therapy, and routine checkups. Despite this story being fiction, it is based on hundreds of real-life incidents that happened here in California. Jose's experience demonstrates what may happen when obstacles to access are eliminated. Medi-Cal and health equity. Medi-Cal is a powerful instrument for advancing health equity and is more than just an insurance program. Barriers to healthcare have existed for decades for low-income communities, especially those who are Latino, Black, and immigrants. Cost. A shortage of culturally sensitive healthcare professionals, anxiety about one's immigration status, and complex procedures are some of these obstacles. Closing these disparities is the goal of policies like AB 133, which expanded Medi-Cal regardless of immigration status. People who obtain insurance are more likely to manage chronic conditions, receive preventative treatment, and have better long-term health outcomes, according to studies. A key component of California's health equity initiatives, Medi-Cal works to remove the systemic obstacles that have kept so many people from getting care. So remember, underserved communities are the ones who gain the most with these new policies, as Medi-Cal is centered on equity. This chart here is brought to you by the article Health Coverage by Race and Ethnicity 2010 to 2023 by Latoya Hill, Nambi Nduga, Samantha Artiga, and Anthony D'Amico. In this chart, you can see the uninsured rate among people under the age of 65 by race and ethnicity from 2010 to 2023. As you can see, since the ACA implementation of Medicaid and marketplace expansions for healthcare insurance in 2014, there has been an increase in insured rates, meaning a decline in individuals who are uninsured. Hispanics seem to be the ethnic group that has received the most from this change, based on the chart. Let's dispel a few widespread misconceptions. First myth, Medi-Cal is inaccessible to those without documentation, but the fact is, if they fulfill the income standards, they will be eligible for full scope Medi-Cal as of 2024. Second myth, compared to private insurance, Medi-Cal provides worse care. The fact is, a large number of Medi-Cal beneficiaries visit the same hospitals and see the same physicians as people with private insurance. Third myth, only emergency care is covered by Medi-Cal. The fact is, comprehensive services including doctor visits, mental health, dental care, prescription drugs, and more are all covered by Medi-Cal. Fourth myth, applying to Medi-Cal is very difficult. The fact is, there's free help available in several languages. Nonprofits, enrollment centers, and community clinics can help you at every stage. Do you need assistance applying or determining your eligibility? The following resources are available. For additional information or to apply, go to www.cov For multilingual assistance, call 800-300-1506. To find enrollment counselors by zip code, use the Find Help option on the Covered California website. For in-person assistance, get in touch with the social services office in your county. Trained navigators are often available to help you through community-based groups such as CHIRLA, Latino Health Access, and nearby clinics. Additionally, keep in mind that application assistance is always private and free. You can also use these QR codes for direct links of access to apply for Covered California and locate help near you. On the left here, we have the application for Covered California, and on the right, we have a link to help you locate help nearby. In summary, the purpose of Medi Cal is to ensure that no one must choose between their health and their income. Take the first step right now if you or someone you know is having trouble getting care. Go to Covered California, seek assistance, give this video to a potential beneficiary. California is demonstrating that we can progress toward a system that prioritizes health, justice, dignity, and inclusion for everyone, and that healthcare is a human right. I appreciate you taking the time to listen in today. I hope you feel educated and empowered to address your health concerns utilizing one of California's greatest resources for health. And don't forget, your health, your horizon. Thank you.